Surgeons of Reddit, what was your biggest oh crap moment during surgery? I'm currently in med school, and this happened a few years ago when I was attending surgery classes. One patient was up for a laparotomy for removal and investigation of an abdominal mass, probably cancer. Imaging tests were really not specific or of much help, as this was some atypical disease presentation. Even specialists couldn't figure it out. To everyone's surprise, the patient's cancer was really a forgotten gauze from some previous surgery. The actual moment of realization went as the surgeon just stopped and said, "Gauze," to which the nurse promptly gave him one, and he went, "Number." There was a gauze inside of him. My dad caused an oh crap moment for a surgeon when he heard them say okay he's out before they were about to start slicing him open. He just had enough strength to move his head from side to side as in no, I'm not out yet. Terrifying. My father is a physician, and although he's not a surgeon, he did some surgery while in med school. He told me a story about a patient he had once, who had necrotizing fasciitis, or flesh-eating disease. The patient had gotten a cut during gardening and never cleaned the wound. My dad told us that he had to peel back layers just to get at it. First, he peeled off the bandages that the patient self-applied. Then there was a layer of holy book pages that he also had to peel off. Following that, there was another layer of bandages and then a final layer of more holy book pages. Beneath that, there was the wound itself, which was covered in maggots. Apparently, they were eating the dead tissue generated by the disease. He said that once they removed the maggots, they were able to begin the surgery to remove the infected areas. But it was because of the maggots that they didn't have to amputate the limb. After this operation, my dad decided to not pursue surgery and focus on becoming a specialist. In some places, medical maggots are used to keep an open wound clean, or a non-healing ulcer from getting more infected. Makes me gag, but it works, I guess. I'm a med student. A surgeon once told me that his oh crap moment was when a patient of his had a carotid artery blowout, very bloody, leads to death within minutes if not treated, due to a tumor growing into that artery. Problem was that the patient was in a small hospital in his hometown with no surgeon available who specialized in this type of cases. Furthermore, there was no way of getting the patient in time to our center as it was rush hour on a sunny Friday afternoon. It was also not possible to transport the patient to our center by helicopter as the hospital in his hometown did not have a helipad. Luckily, our hospital did have a helipad with a helicopter available, so they took the surgeon by helicopter to the smaller hospital. Since there was no helipad at the hospital, the pilot was forced to land the chopper in a park. And mind you, it was a sunny Friday afternoon, so it was full of people. As soon as the chopper landed, a crowd formed around the helicopter. The surgeon told me that the moment he exited the chopper they all started clapping and cheering for him, making him feel like star. He ran to the hospital and into the operating room and immediately started operating on the patient. He was done around 2 AM, but the patient made it. Dang, good way to get hyped up to succeed. I'm a medical student going into surgery. I get my MD in a year. I haven't been at this long enough to have the wealth of stories that an actual surgeon would have, but I have a few that stand out from my time in the OR so far. Most recently, I was assisting on a lung surgery called a decortication. This is done when a lung is trapped in place either by a complex infection, inflammatory tissue, etc., and needs to be freed up to work properly. This lady was middle-aged, but has a history of several bouts of pneumonia and a 30-pack year smoking history. Going into the procedure, we weren't sure exactly what we'd find, but were hoping it was just scar tissue from the untreated pneumonias. As soon as we got inside her chest with the scope, it was obvious that this was not the result of infection. Her entire lung was essentially caked in cancer tissue, adhering it to her chest wall and her diaphragm. We had discussed this possibility with her, and had her consent to do whatever was necessary once the surgery began. At that point, all the minimally invasive scopes and instruments went away, and my attending guided me through an open thoracotomy. This involves making a large incision between the ribs, snipping out 2 of the ribs, and using a rib spreader to gain access to her chest. Once inside, my attending obviously did the work and I just assisted, but we removed her entire lung and some lymph nodes for testing. Her chemo started the next day and she's fighting now. So, I guess it counts as oh crap when you open up a chest and find a thicket of cancer staring back at you. I am a nurse and the doctor was an anesthetist, but still relevant. Patient had her surgery. I can't remember what. All went well. She was awake and in recovery. We needed to give her a medication through her IV line, so, as is standard practice, we flushed the line with 10 ml of saline. The patient immediately stopped breathing. We had no idea why. We called a code and the anesthetist came running. He actually said "oh crap" when he realized what had happened. During the surgery, the anesthetist had given the patient rocuronium through that IV line, and he hadn't cleared the line afterwards. So when we flushed the line, the patient got a dose of rocuronium that had been sitting in the line. Rocuronium is a muscle relaxant, used to inhibit the respiratory muscles to allow for intubation and ventilation during general anesthetic. In layman's terms, it paralyzes the breathing muscles, so you can't take a breath no matter how hard you try. But it does not put you to sleep. This patient was wide awake but totally unable to breathe. Luckily the anesthetist worked out quickly what had happened, and it's easily reversed. The patient was physically fine, but understandably traumatized. Jesus Christ, that's my worst nightmare. Not a surgeon, but a student. In the early days of this teaching hospital's high school volunteer program, they essentially used us as free tech labor, but when things were otherwise slow, they'd toss me some scrubs and send me to watch cases in the operating room with the med students. Since my mom worked there, they were sort of testing this out with me. On the very first case I saw, the surgeon lost the needle from the end of the suture in the abdominal cavity and couldn't find it. They ended up wheeling in an X-ray machine to locate it. During the next surgery I watched, the surgeon heard student and assumed I was a resident. He launched into an X-rated joke he claimed he found on the back page of Penthouse. When he finally hit the punchline, no one laughed. Finally someone asked if he remembered our visiting student. He turned and asked, "You're a resident, right? Not like you're some virgin." I clarified that I was a freshman, not a resident. He paused and whispered, "College." I replied, "High school." When he realized I not quite 14, he started screaming at the anesthesiologist for setting him up and threw a tray of scalpels and forceps at him. It took a few minutes to get the correct count for the number of tools and their locations after that, and the anesthesiologist switched rooms with a buddy. After this he was extremely professional and formal, but still didn't bother to ask my name. He did a great job on the patient. The oh crap moment came when my mom met him in the call room a few hours later and said, "I heard you had some drama in your room today, happy to have someone to vent to." He launched into the story and embellished a bit about how bad it was to justify throwing scalpels. I think he called me jailbait. That's when she said, "You know that's my daughter?" You could hear him cursing the anesthesiologist all the way down in recovery. Wowie. Some years ago my wife went in for surgery and we asked to have her tubes tied at the same time. After the surgery, the doctor came out to talk with me. He told me the surgery went great and that she's just coming out of the anesthesia now. I asked about the tubes, and his eyes got really wide. He said, "I'll be back in a few minutes," and practically ran back to the OR. They had to put her back under and reopen the sutures. I'm glad I asked about that, or we might have had a much bigger surprise than that. I just got my tubes tied during my last section about a year and a half ago. Thanks for terrifying me. Or nurse here. Had a patient with an ascending aortic dissection who was delayed getting into the OR for a few stupid reasons that had nothing to do with us. Fortunately, patient was still stable. Finally got the patient on the table and began to apply the skin prep solution. Suddenly, we start hearing the anesthesia machine start making the unmistakable sounds of vital signs plummeting. The patient turns blue and codes, shorthand for cardiac respiratory arrest. After a 35 minutes or so of resuscitation and trying to get to the air, the patient didn't make it. I'm recovering from an aortic dissection right now. It was just below my brain on the left side. I didn't stroke or anything, but recovery is a long slow process. I can't really get people to appreciate that. Basically I should be dead. You did all you could, and the odds were already up against you. If they could, they would thank you for trying. I'm not a surgeon, but I was a patient. This one time the anesthesiologist came to my room before surgery and injected me with something. I don't remember clearly, but the moment they made the first incision, I woke up and screamed so loudly that the god of Hades would die. Turns out I was still conscious but fell asleep while counting from 10 to 1. The anesthesia was not proper and I got the surgery 3 days later with the proper anesthesia. Dude, thanks, I'm having surgery on Friday. Obligatory, not a surgeon, but a student assisting in the operating room. 65-year-old guy with kidney problems, possibly cancerous, needed to have a chunk of his kidney removed. Okay, no big deal. We give him meds, knock him out, then prepare to operate. We removed his gown, and everyone in the room froze. One of the surgeons actually said holy fuckballs, which is relatively accurate. Apparently our guy had some muscular disease that caused a massive abdominal hernia, and his intestines were herniating into his nutsack. His scrot was honestly about the size of a deflated basketball. Then there was the time we had to amputate a lady's leg that was riddled with gangrene. I was with the nurses cleaning the patient for surgery when the surgeon came in to check on us. One of the nurses pressed too hard on a dressing and it popped a blister full of pus across 2 people. Everyone screamed then dry heaved at the smell. Freaking horrendous. Swamps of Dagobah story incoming. My mother had a cerebral hemorrhage 19 years ago. I was away on holiday at the time. Insurance paid out and got me flights back quickly as it was touch and go whether she survives the attack or the upcoming surgery. When I returned, the brain surgeon come to tell all my immediate family that he first operated on the wrong side, but he also said that he found the aneurysm ready to go, so he clipped that side then proceeded to do the problem side. Remarkably, she survived. She is still going strong 19 years later, age 75, but does suffer with memory loss and trouble writing. Patient had bitten through the trach tube and I didn't know the gas anesthetic was leaking out. I was trying to concentrate on monitoring the anesthesia and grab instruments, and assist was feeling sleepy and sick. And the patient was super light but still out, and I had the gas cranked as high as it would go. I finally smelled the dang gas and held my finger over the hole in the tube until surgery was finished. When I was a med student on my surgery rotation, we had a patient code just as we started the first incision. It was a laparoscopic surgery, and we were making the opening for the first trocar, when all of a sudden the anesthesiologist says start compressions. The attending said, what, and the anesthesiologist confirmed that yep, patient had suddenly died. Sterility went out the window, all organized and effective. Heck broke loose. The patient's heart started up again, and they recovered fully. I never heard why it happened. It was the strangest thing I've seen in the OR, and I've seen some weird stuff. Not a doctor, but my dad was getting a cardiac catheterization done and the doc forgot to give him a local anesthetic. The nurses were very confused when he turned stark white and almost passed out until they realized he wasn't given anything to numb the pain. Funny thing about is my dad was too embarrassed to say something about the excruciating pain he was feeling. BC, he didn't want to be seen as a big baby. SMH. Your poor dad. What a trooper. I'm a dental student, but during a surgical extraction case my partner was wiggling the wrong tooth for a good 5 minutes before I looked and realized what was going on. She was supposed to do one just in front of it, so I just tapped the tooth with the suction and her eyes got real freaking wide before she moved the elevator forward. LOL. PT was okay though. I caused my oral surgeon to have an oh crap moment. I had to get my wisdom teeth removed when I was 18 and I have anxiety, so I was put under. They put the IV drip in my arm, which caused me to freak out a bit but nothing major, and I was out. I woke up with a blue microfiber towel on my hand where the pulse monitor was. I asked why it was there to the best of my ability and found out that in the middle of the surgery the pulse monitor started beeping. I have very poor circulation and the IV made my hand so cold the pulse monitor thought I was dead. The oral surgeon of course started to get worried before realizing what was going on. I had something similar with mine. I have Raynaud's, which causes crap tear blood flow in my extremities sometimes. When they put me under, most of the blood flow to my hand up and quit, as it does sometimes. Apparently they had to swap fingers a bunch during the surgery before settling on my other hand, and throwing my mother's coat over that one to keep it warm. My mother is a doctor and during her training she was assisting as an anesthetist alongside a senior surgeon and other junior doctors. The senior surgeon had a very short temper which was known amongst most of the faculty. Towards the end of the surgery one of the junior doctors ended up making a minor mistake, I forget what he did, and the senior doctor stabbed him with a scalpel and had to keep on working on the surgery. Afterwards my mum had to patch up the poor guy, and for reference this was a while ago, back in a time where a senior doctor like this could end your career before it even began if you spoke up, so he and others went and regulated for years. My brother broke his arm on his 6th birthday. OFC. Had to get pins put in. He wakes up from the surgery and tells the nurses that his fingers feel kinda numb. Turns out that the pins had been placed wrong, and if he hadn't said anything he probably would have serious damage to that hand. My kid did that recently. Every medical person that came near us till it was healed checked fingers and upper arm for numbness. As a slightly gross aside, the pins were taken out by the doc just pulling them out with a pair of pliers. Poor kid was not happy. I was in a surgery once for a large abdominal hernia repair. We cut out around the belly button on a stalk to replace later but forgot to mark on the side skin we took out what vertical level it should be at when put back. The surgeons all eyeballed it and tried to guess based on feeling where her hips and ribs were under the drape. They placed it perfectly in the end, but it could have been a disaster to have your belly button end up too high or low. Doing a foot surgery. Trying to screw the bone. Just me and the attending. We're screwing the screw as hard as we can and it's not biting. We try a smaller screw. We try a longer screw. Still isn't biting. Then, crunch. A few bone chips and K-wires later, and we had it fixed. But goddamn, I was sweating for that small period of time. Stop trying to frick my bones and patch me up, please. Not a surgeon's oh crap, but it happened during surgery. More of the anesthesiologist oh crap. Though the surgeon was probably pretty worried too. I went in for a scheduled C-section at 37 weeks with my first and only kid, and at the time my first surgery ever, unless you count wisdom teeth. They decided to do the C-section because my kid had an in utero growth spurt and at 37 weeks was 11 pounds. If I went to 40 they were concerned my kid would be 15 pounds plus. Check-in and everything was great. They got me prepped and wheeled me into the surgery bay. Then the anesthesiologist came in to give me the spinal block so they could actually cut me open. They injected the stuff into my spine while I was sitting up, then laid me down in the bed. The moment I was horizontal my blood pressure tanked to 60/40 and I started vomiting uncontrollably. Thank God I hadn't eaten anything so it was just bile. My obgyn had to start the surgery immediately while my anesthesiologist tried to do something. I dunno, I was pretty out of it. I vaguely remember they whisked my kid off to the NICU, my mom going with her and my other support person stayed with me. I honestly don't remember most of what happened because I kept losing consciousness from my blood pressure being so low. My mom told me after the fact that they had brought a crash cart into my recovery room because the doctors were super worried my heart was going to stop. After about 4 hours my blood pressure finally stabilized and I was okay. I ended up being in the hospital for 4 or 5 days recovering from the C-section. Goes to show that sometimes even a routine surgery can end up being holy frick. Most anesthesia doesn't work on me. I had an endoscopy and woke up in the middle and fought the entire staff to pull the tube out. For my C-section they gave me a spinal tap and an epidural to make sure, but I was able to move and feel most of it. I woke up partly to try to pull the trach tube out during my appendectomy. I told all this to my doctor before a jaw surgery so they didn't even bother knocking me out. Kept me awake while removing part of my lower jaw. Luckily I have an extremely high pain tolerance. This actually was before surgery. A rugby player from Australia came to us after one of his friends kneed him in the face and shattered his lower jaw and most of his incisal teeth and cuspids bicuspids. It was a lot of work. We had to use an operating theatre last minute. Dentists usually have to reserve this room, and had him heavily sedated. Had a CT scan done on him to see how bad it was and check if the fractures migrated to the rest of his skull. We had to get some help from a plastic surgeon to peel back his gums and cheeks, reorganize the remaining bone, dispose the failed teeth. We normally try to save them, but then 8-hour-long surgery with multiple smaller procedures over the next few months to check for stability and gradually remove the screws, stents and framework. Probably the hardest job we ever did. Not the one that got my mom her second diplomate, but still pretty impressive. Definitely an oh crap moment, lol. I normally help my mom with surgery, but this was too much for me. I was about to puke when they were peeling his face back. He lost all his teeth in the front, but because it healed so well after 8 months, CGF stem cell technology is a miracle. We gave him a set of dental implants and zirconia bridge work. The plastic surgeon used PRF stem cell technology to heal the incisions and prevent any scarring, and now he looks better than ever before. He made his friend pay for all the damage. Patient here. Take your pick. Had an ectopic pregnancy and they forgot to give me any analgesia, so when I came to I screamed the place down, screaming if I was a dog you'd put me down. Obviously not my finest moment. Had my son and I told them I didn't feel right. Totally dismissed by everyone till I flatlined and I was going to sleep, i.e. dead. Got baby out and gave me atropine and I was okay, as was son thankfully, but it was touch and go and I hemorrhaged badly. Had a hysterectomy and they didn't notice the internal bleed and I started going into total organ shutdown. My iron count was 2 before they realized, and then I had 2 nurses squeezing flood into me. The surgeon did apologize that it wasn't his finest work. Radical nephrectomy, removal of a honeydew melon-sized cancerous tumor on my kidney. It had stuck to stomach and bowel, so lost a bit of those, then got sepsis. Had a car accident when I was 17. Went straight through the windscreen and seatbelt locked, so I ended up in the seat with face mangled. Every so often a piece of glass comes out, but there was a piece in one of the big scars, so I went to A&E to ask for a scalpel as I was happy to remove it, and they panicked and I was rushed into surgery as if it had moved. It could have entered bloodstream and heart, and he still didn't know if he got it. I'm a walking disaster. Death really wants to meet you. My mom has fibromyalgia. Even sedated, if the surgeon touches her foot it will jump. My mom nearly had a botched foot surgery because of this and scared the crap out her surgeon. Ironically, the foot that was nearly botched is now her better foot. She had rods put in both feet to correct damage that had just been left for years. The knee bone's connected to the something. The something's connected to the red thing. The red thing's connected to my wristwatch. Oh. I'm gonna need the full story. My mum's left arm seemed to give her surgical team an oh crap moment with one heck of a spiral fracture. When 5 surgeons all ask you're not left-handed are you, it doesn't instill a lot of confidence. To be fair, they did the bloody good job after 5 hours in theater, and she gets to amaze her grandkids by proclaiming herself cyborg granny, and she hopes she'll excite some archaeologists somewhere down the line. There are a lot of pins in her arm now. When I was fresh with the knife many years ago, I forgot to give my patient a liquid to cleanse out the inside. I realized this as I cut into the stomach wall and was met with my patient's undigested dinner from the previous night. Not a surgeon, but caused a sort of oh crap moment. Back in 2011, I had an unscheduled surprise amputation. They tried to save my middle finger, but the veins couldn't regrow. Side note, it's a special kind of depressing to watch a body part decay off of you. A couple weeks later, I went in for outpatient surgery to have it removed. I thought it would be funny to put a Swiss Army knife in my brace with a note that read "Please attach." Apparently my surgery was delayed by almost a half hour because the surgeon and the rest of the crew couldn't stop laughing. A little different than the other stories, but my old roommate had some sort of surgery and the anesthesiologist turned out to be the father of this girl I was casually hooking up with. My friend said the last thing he remembered before going to sleep was the doctor saying, "So you know my daughter," to this. He only remembered trying his best not to shout out, "My roommate is banging your daughter." Not a surgeon but a patient. I had a bad case of mono. Couldn't eat for about a week because my tonsils were so swollen. There was physically no room to swallow even chewed up food. so I needed to have my tonsils removed. They take me to the room where they're gonna do it and I'm already a bit scared. Never been in the hospital before, never mind having surgery. I'm 23 at the time, so also no parental support cause it's the middle of the day and they can't get off work because their 23-year-old son has to have his tonsils removed. So I'm alone. So they prepare for the procedure and get me knocked out. Next thing I remember is waking up to the craziest coughing fit I have ever experienced or will again. I didn't even have brain power to try and control what was going on. My entire body was just intensely focused on coughing for what felt like 5 minutes. It was more like 1 minute, convulsing, tightening and almost cramping. I remember it stopping and then passing out. Not sure if from exhaustion or anesthesia. Turns out a fuckload of blood had fallen leaked into my lungs during the procedure. I was basically fine though, just ended up having to recover for 4 days from a lung infection. Thinking back to that 1 minute, or however long it actually was, is still pretty scary. I was not in control of my body at all, just a lifeless passenger in a coughing body. I imagine this is what dying is like, without the coughing. You just experience things happening to your body but have no control over them. Well, fear's sort of an odd thing. When I was in residency, my first solo procedure was a spinal surgery on a 16-year-old kid, a girl, and at the end, after 13 hours, I was closing her up and I accidentally ripped her dural sac, shredded the base of the spine where all the nerves come together, membrane as thin as tissue, and so it ripped open and the nerves just spilled out of her like angel hair pasta, spinal fluid flowing out of her and the terror was just so crazy, so real, and I knew I had to deal with it, so I just made a choice. I'd let the fear in, let it take over, let it do its thing, but only for 5 seconds. That's all I was going to give it. So I started to count. 1, 2, 3, 4, 5. Then it was gone. I went back to work, sewed her up and she was fine. Not in surgery, but I was still a surgeon at work. I was called to the emergency department to see a patient involved in a motor vehicle accident. I wasn't there for the handover from the ambulance team and I didn't really know what had happened. When I got there, all the emergency doctors were busy trying to keep the guy alive and so I didn't interrupt straight away to find out exactly what it was that they had called me for. I thought I'd give them a few minutes to try to stabilize the patient. I noticed that one of the legs sticking out from the blanket was feet pale, so I touched it. Bit cold. So then I tried to see the capillary refill. Not really obvious. So I checked for a pulse on the top of the foot. Nothing. Then around the ankle, also nothing. I'm starting to get a little bit worried. So I reach up behind the knee to feel the next pulse that you would normally check. And to do that properly you have to put fairly firm pressure because of the muscles in that area partially cover the blood vessels. Instead what I do is lift up an amputated leg and pull it towards me and then fall on the ground with the leg in my hands, trying not to let the juicy bits hit me in the face. Turns out that he had an above knee traumatic amputation and they had put the leg on the gurney to come in with him. He had a stump with a tourniquet in place under the blanket. I almost pee my pants. Had 10 people immediately look at me and wonder what on earth I thought I was going and had to gently put the leg back where I found it and pretend like it had never happened. Yeah, no one that saw it let me forget. But pulling a knife out of a guy's chest like Excalibur did suppress the story about the leg a few months later. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.